we are the institution working with COVID control in Latvia. Therefore, I will just share some basic things about COVID contra-epidemic measures in Latvia you have to follow if you are here. The first thing I want to stress that epidemiological situation in Latvia is quite good in this moment. Every day we have 5 to 15 cases, and our incidence of disease is one of lowest in Europe. Even some days, even lowest in the European Union. Therefore, this is quite safe to go around and to be in Riga and to visit also some public places in Latvia in this moment. Although, as we know from the spring and the beginning of summer, the situation can change quite fast. Therefore, I really ask everybody to follow Latvian situation. And there are several ways how to follow it, and how to know more about situation in Latvia. The one thing, you can visit webpage of CDPC of Latvia. And then you can see every day, you can see statistics, how many cases we have, and is there any kind of alarm, maybe some kind of additional measures implemented that day or that week, etc. That's one thing what you can do. There's also official web page it's covid19.gov.lv, where you can follow information in English. Yeah, in our web page, CDPC web page, it's mainly in Latvian, but you can see very updated statistical information about situation. But if you want to read in English, then you have to go to official web page of covid19.gov.lv. Despite of the fact that in Latvia situation is quite good, we know that in other countries around Latvia, the situation is worsening day to day. And there is also some limitations for people arriving from abroad to Latvia. Every Friday, CDPC publish the list of countries, and we categorize them in 3 levels. The first level is, as we call, safe countries. We call it white countries. And in these countries, the incidence of disease is lower or the same or quite similar to Latvian situation. And if you arrive from such country, you don't have to follow any additional rules. You just do your daily work and follow your symptoms. And if you have symptoms, then do testing, for example, and stay at home. Otherwise, you don't have any restrictions to go around. If you arrive, for example, now it could be if you arrive from Estonia and you didn't, and you don't have to self-isolate. Another thing is the next level is countries with the incidence above 16, and then you have to self-isolate for 14 days for 2 weeks. And then the next category with a high incidence is about 25. Then there's limited possibilities to travel to these countries with a plane. Just exceptions. Accepted groups are allowed to travel and to arrive from these countries. But if you arrive in Latvia, you also have to follow self-isolation for 14 days. The one very important fact in Latvia is that we don't have a mandatory testing for arrivals for all groups, like in general for all arrivals. And even it's quite often that people ask, if I will do testing, maybe I can go around this and don't follow self-isolation. No, in Latvia, we follow the rules that the incubation period of disease is 14 days. And the best way to protect society is that the people are staying at home and don't visit public places. Therefore, even if you have a negative test, it doesn't mean that you can go outside your apartment. Another important aspect for arrivals is to remember that if you arrive from the yellow or red country, that you are under observation of police, and it's quite possible that they will contact you. And to make sure that you understand that you have to be in self-isolation. Another thing, what do we mean by self-isolation? So basically, you can go to the webpage and read in details, but basically, you have to have a mask when you go to your place from airport or from railway station, and then stay there and don't go to work, don't go to university, don't attend any public places. There could be some exceptions if you don't have possibility to buy some food, for example, and you don't have anybody who could help you, then maybe you have to find some hours when it's quite, then there's no many people in the shops, and then go there just to buy, to have a basic things you need. But of course, I suggest to be in safe areas and try to find somebody who could help you with that. That you don't go outside if it's not any kind of force majeure to go there. That's about self-isolation after arrival from countries with a high incidence. Another thing is important thing for everybody in Latvia is to remember about testing. And in Latvia, in this moment, we have testing is available. And even if you don't have any symptoms, you can call to the number 8303 and you will be signed for the test if you have some kind, if you feel sick, for example, or if you have some doubts that you have a contact with infectious person, for example. Therefore, tests are available, but of course you have to call in advance, and you also have to sometimes you have to wait for some hours or even day if the intensity of testing is high. And then you have to go to this special point by foot or by bike and do testing. Yeah, therefore testing is available, and it's the answer you will receive in quite soon. Yeah, but I want to remind that it's not some kind of alternative for self-isolation. Self-isolation is the basic rule to control infection in Latvia in this moment, due to situations that we don't have community transmission in Latvia, and most of cases in Latvia are imported or related to some outbreaks already known. Due to our epidemiological investigation, we find some positive cases. Okay, what else? Another thing what's true now and will be true also, I think, for all winter, is that we have to continue to follow distancing as much as it's possible, just to keep safe distance from others. So the best way is to have 2 meters. Next is hand disinfection and hand washing, and also self-cough hygiene. Don't put your hand in front of you when you cough, just use another brace or some tissue to cough. That's why it's so important, because despite of the fact that everybody's a little bit scared from COVID, we know enough about the virus to say that it's mainly spread in aerogenic and droplet way. Therefore, if you have a safe distance from others, you will be the risk to have an infection will be small. Another issue, we still recommend to avoid public events with many people, especially if you know that it will be difficult to follow this distance rule, and especially the high risk in the middle of summer. We noticed a quite high risk in public pubs and nightlife. Therefore, it's some kind of risky behavior in this moment in COVID transmission era, in pandemic situation. I see that I have some questions. Maybe I will try to answer them. The first one is, are you allowed to go grocery shopping while self-isolating? As exception, as I said at the beginning, if you don't have other solutions to have a food, then you can do that, and with mask, and also try to choose hours where there's not so many people around. Is it possible to self-isolate with other students arriving on the same day? That's a tricky question. The best way is to isolate, that just you one is isolate, each person must be isolated, because I will explain why it's risky. Because if in one moment one of the persons grouped together for self-isolation will have a positive test or will catch COVID-19, then you will have a longer period, because you will be classified as contact person, and you will have to stay even more days at home. Yeah, that's the risk you will have. But if everybody will be healthy in the day 14, then of course, then if you accept that risk, that the self-isolation period will increase, and yes, that's possible. What about the situation to have quarantine in shared living where other students are out of quarantine? It's actually the same question. The quarantine, it means that you must be alone as much as possible. Maybe it's done, it could be done if you have a separate room or separate area in a large apartment. But basically, I suggest to have one separate place for that. Otherwise, other people in the same area will be at risk. But yeah, is self-isolation required if you have positive test for antibodies? Yes, then there is a solution for this situation. It's quite more and more common that people are from abroad arrive to Latvia, and sometimes they do test and they are even RNS positive, but it doesn't mean that people have positive, that they have a virus, active virus, infectious. Maybe they are not infectious. And at this moment, if you have a doctor responsible for you and you do antibody test, then doctor could decide that yes, you don't have to follow self-isolation. It's possible with doctor permission, but then doctor needs this laboratory result. And in the best situation, 2 results: RNS positive test in the past when you had disease, and a high titer of antibodies. Yeah, but it's possible according to nowadays law. Is it mandatory to wear a mask in Latvia? No, not in this moment. But as I said, the situation could change quite fast, and therefore try to follow information in media. And of course, if masks will be introduced, then it's quite possible that it will be in situation when we have a community spread, and you will receive that information. But in this moment, there's no places except hospitals and social care centers where masks are mandatory in public area. Who is going to control self-isolation? Police. Yeah, because when you arrive in Latvia, you have to report that in airport or in other border control institutions that you are arriving from risk area, and police is responsible for control, and they do that. Yeah. Okay, that's basically all for me. Maybe some more questions. No more questions? Okay, thank you.